maxillary artery, which is a branch from the external what? Carotid artery. For the upper teeth, we have 3 branches, superior. No. For the upper teeth, we have superior alveolar arteries that's supplying the anterior, middle, and the posterior part, the posterior teeth, which is the anterior superior alveolar nerve, and the middle superior alveolar nerve, and posterior superior alveolar artery nerve. Clear? So for example, when I said anterior superior alveolar artery, supply which teeth? Incisors and the lateral, central and the lateral what? Incisors. When I said middle superior alveolar nerve, artery supply which teeth? The premolars. The posterior superior alveolar nerve supply the upper molars. Clear?
Yes.
So all these arteries are branched from the superior alveolar nerve, divide to the anterior, middle, and posterior because of the location of the teeth. Okay. For the lower teeth, they get the blood supply from the inferior what? Alveolar artery, which is a branch also from the maxillary artery. The venous drainage for the anterior teeth, upper or lower, will go to the facial vein, while the posterior teeth will drain to the pterygoid plexus. The lymphatic drainage, mostly all the teeth drain to the submandibular lymph node, while the anterior teeth, they will drain to the submental lymph node. That's why when there is severe or acute inflammation in the teeth, we all the time what? Do the palpation for the submandibular and the submental lymph node, because if there is a swelling, means there is acute inflammation. We have to give what? Antibiotic. For the innervation, the upper teeth also receive the innervation from the superior alveolar nerves, a branch from the maxillary nerve, while the lower teeth receive the innervation from the inferior alveolar nerve, which is a branch from the mandibular nerve. And both of them branch from the which nerve?
Maxillary.
Maxillary and mandibular nerve. Branch from which nerve?
Trigeminal
nerve. Okay, for the sensory, we're talking about the sensory. Okay, so for the tooth decay or tooth caries, of course, they will start the decay in the enamel grooves. This is the base location. These the small grooves that you found in the teeth. This is the base location for the bacteria to start the destruction. Of course, if keep it with at the enamel level, still there is no what? Pain. The patient will not feel pain if only the caries at the enamel. But if or start reach to the dentine, it will start be painful when he eat or drink hot or cold or sweet. They will start feel painful. But if the tooth carie already reached the pulp, the painful will be very, very strong. Even if you take the patient take the painkiller only stay for maximum 1 or 2 hours, and the pain come again. So in this case, only need root canal treatment. In this case, only root just filling and will be okay. The dentin will be regenerate by itself. In this case, also just filling and will be okay, safe. Okay. So for the tooth care, what is the oral hygiene? When you define the oral hygiene, why we do oral hygiene? For what? To prevent the dental caries, gingivitis, periodontal disease, and the bad breath. That's why we do what? We have to take care of the oral hygiene, not just for the tooth, for the all. We talk about the all oral cavity. Okay? So we have regular cleansing and there is professional what cleaning. What is the regular cleaning? By removing what this is by toothbrush or flossing. We remove this layer, the tartar, which is the mineralized plaque. In this stage, still can be removed by the just toothbrushing and flossing, dental flossing. But in case already mineralized or very become hard, this tartar become hard or the plaque become hard, only need the professional cleaning by the which is we call it tooth scaling. Okay, of course this one done by the only dentist in the dental clinic because you need a special device to remove all these hard deposit of the plaque. For the healthcare professional recommendation, of course, they advise you to do regular brushing twice a day or after each meal. Of course, dental flossing, people sometimes they do toothbrushing, but they still complain from the bad odor or bad smell from the mouth. This one we treated by the mouthwash or dental flossing, the important dental flossing, by the way, because it cleans between the teeth. The toothbrush cannot reach the between the teeth, very tight contact. So only by the flossing can clean the teeth and to avoid what this bad smell. Okay. So for the protective treatment that we use to reduce the tooth caries, first of all, we use what? Fluoride therapy. This fluoride therapy, either in the water that we drink, they put a what structure and reduce the formation of the tooth caries. Or we can give as supplement. Also, there is a tablet as a fluoride. You can take it to prevent formation of the tooth caries. The typical fluoride that we use daily, which is the toothpaste. Of course, the toothpaste contain fluoride, what concentration of the fluoride to prevent the tooth carie formation. And the mouthwash also contain what? Some concentration of the fluoride. The other protective treatment, we call it dental what? Dental sealant. This one actually we do it for the kids. See, before even there is a caries, no caries. We do it as protective or preventive therapy. We use some kind of the filling material. We fill these grooves. So the bacteria will not have the chance to grow in these grooves or fissures of the tooth and reduce the caries formation on the kids until they will have what? Their permanent teeth. Because you know the kids they not do daily brushing and they not care about the oral hygiene. So this is the best way to avoid tooth decay. In the kids we do dental what? Sealants. Clear? That's all. Any question?
No.
No, doctor.
Clear?
Yes,
Yes.
doctor.
Okay. Okay, I will try if upload today in the system. In case there was still delay, I will send by WhatsApp. Okay.